Diabetes is a chronic condition that affects millions of people worldwide, and finding the most effective medications for its management is crucial. In 2023, significant advancements have been made in the field of diabetes medicine, offering a range of options for patients. In this video, we will explore the best diabetes medicines available in the United States. GLP-1 receptor agonists. GLP-1 receptor agonists, oh boy, that's quite a mouthful. But don't worry, they're not as complicated as they sound. These medications basically pretend to be your body's hormone. GLP-1, which is responsible for keeping your blood sugar in check. It's like having a little sugar-slinging superhero in your system. Now, these GLP-1 receptor agonists, or let's call them GLP-1 buddies, are here to help you out. They offer some pretty cool benefits like reducing the risk of cardiovascular and kidney diseases. So not only are they keeping your blood sugar levels in check, but they're also protecting your heart and kidneys. Talk about a multi-talented medication. You might come across some familiar names in the GLP-1 buddy squad, like Ozempic, Trulicity, Victoza, and even the pill form called Rybelsus. Now, here's the catch. They're not exactly pills you swallow with water. Nope, these guys like to be injected under your skin. It may cause some nausea at first, but hey, no pain, no gain, right? Usage. So imagine you're doing your best to manage your blood sugar levels through lifestyle changes like eating healthy and exercising. You're a star, but sometimes that sticky blood sugar just won't cooperate. That's where GLP-1 receptor agonists come to the rescue. These medications are like the sidekicks to your lifestyle changes, providing that extra boost to get your blood sugar under control. They join forces with other diabetes medications to form an unbeatable team. But hey, don't worry. If you haven't achieved perfect blood sugar control with your lifestyle changes alone, GLP-1 receptor agonists are here to lend a hand, or in this case, a syringe. They help regulate your blood sugar levels, making sure they don't go off on a wild roller coaster ride. Normal adult dosage. The specific dosage of GLP-1 receptor agonists may vary depending on the medication and individual needs. It is essential to consult with a healthcare professional to determine the appropriate dosage for you. How to use. These injections are usually given once a week, which means you have plenty of time to psych yourself up for the moment of truth. You might feel like a pro after a few tries, confidently choosing between your abdomen, thigh, or upper arm as the perfect injection spot. Remember though, it's important to follow the instructions provided by your healthcare provider or the medication's packaging. They know best, even if it feels like you're decoding some ancient manuscript to perform an injection ritual. Just make sure you're injecting under the skin, not trying to tattoo your favorite motivational quote. And hey, if you're feeling a little nervous about the whole process, you're not alone. Injecting yourself takes some bravery, especially if you're not a fan of needles. But remember, you're doing this to take control of your diabetes and keep those blood sugar levels in check. So take a deep breath and go for it. Dosing interval. Think of it like a weekly appointment with your favorite celebrity doctor. You wouldn't dream of missing that, would you? Well, the same goes for your GLP-1 receptor agonists. They have a strict itinerary and they're not going to budge an inch for your forgetfulness or laziness. You see, the key to optimal effectiveness is consistency. These medications work their magic over time. So it's essential to give them the opportunity to do their job. Skipping doses or extending the interval is like canceling that much-awaited dinner date with your favorite dessert. You're denying yourself the pleasure and leaving your blood sugar hanging in suspense. Now, I know life can get busy, and it's easy to forget things. But come on, people, this is your health we're talking about. Set a reminder, tie a string around your finger, or tattoo it on your forehead if you have to. Well, maybe not that extreme. Just find a way to remember when it's time to give your GLP-1 receptor agonist its weekly spotlight moment. Side effects. When it comes to GLP-1 receptor agonists, there are a few side effects that might make you want to reconsider your breakfast choices. Nausea? Check. Vomiting? Double check. And just to keep things interesting, occasionally pancreatitis too. Now, I don't know about you, but a little quizziness and the occasional urge to toss my cookies isn't exactly my idea of a good time. But hey, everyone's different, right? If these side effects become unbearable, It's best to reach out to your doctor faster than you can say medication-induced roller coaster. And hey, if you're lucky, maybe your body will handle a GLP-1 receptor agonist like a champ, and you won't experience any of these side effects. Just remember though, if you start feeling like you're auditioning for a role in The Exorcist, it's probably time to have a chat with your healthcare provider. SGLT2 inhibitors. Now, let's talk about those fancy sounding SGLT2 inhibitors. These medications are like the bouncers at the nightclub who don't get glucose back into your bloodstream. But hey, these inhibitors are not just here to make your trips to the bathroom more exciting. They actually help lower your blood sugar levels, which is a pretty big deal when you're dealing with diabetes. And that's not all. They also have some extra perks like potentially reducing your risk to cardiovascular problems and giving your kidneys a little extra protection. It's like having a superhero duo watching over your heart and kidneys. You might come across some tongue-twisting names like Jardiance, Farxiga, and Invokana when talking about SGLT2 inhibitors. Don't worry, they're not secret code names for a top-secret mission. They're just the brand names of some popular SGLT2 inhibitors available in the market. Just imagine taking a pill and having these inhibitors do their dance inside your body, keeping that glucose in check. Usage. So you've been working hard on those lifestyle modifications, trying to tame that wild beast called type 2 diabetes. You've cut down on the sugary treats, hit the gym like a champ, and even attempted some yoga moves that made you question the flexibility of your own body. But alas, your blood sugar levels still refuse to play nice. Enter the SGLT2 inhibitors. They're like the superheroes of the diabetes world, swooping in to save the day when lifestyle changes and other oral anti-diabetic medications just aren't cutting it. These mighty medications are specifically designed for individuals who need a little extra help in controlling their blood sugar levels. You see, SGLT2 inhibitors work their magic by blocking the reabsorption of glucose by your kidneys. They basically tell those sneaky kidneys, hey you, don't you dare steal that glucose back. Let it flow out with the urine and let's bid farewell to those high blood sugar levels, kicking out any excess glucose that tries to crash the party. Dosing interval. Now let's talk dosing. SGLT2 inhibitors are taken orally, so no need to sharpen your needle phobia skills. Just pop that pill once a day and you're good to go. Oh, and don't forget to take it with or without food. It's your choice. Just make sure you don't mistake it for a mint and offer it to your friends. They might wonder why you're so generous with your candy. Normal adult dosage. The dosage of GLT2 inhibitors can vary depending on the specific medication and individual requirements. Your healthcare provider will determine the appropriate dosage for you. How to use. Now here's a tip. If you're planning to enjoy a meal fit for a king or queen, it might be a good idea to take your SGLT2 inhibitor before diving into the feast. That way, the medication can do its magic and help your body handle the glucose from all those delectable dishes. Just remember, moderation is key. Don't go overboard and think you can devour an entire pizza or a mountain of pancakes just because you've taken your medication. Balance, my friend. On the other hand, if you're not much of a breakfast person or prefer to grab a quick bite on the go, no worries. You can still take your SGLT2 inhibitor without any food. Side effects. While these medications can do wonders for controlling blood sugar levels, they do come with their fair share of, shall we say, interesting side effects. Let's dive into them, shall we? First up, we have the increased urination. Yes, get ready to become best friends with your bathroom. SGLT2 inhibitors have a way of making you feel like a human fountain. But hey, look on your bright side. You'll be well hydrated and have a great excuse to take those extra bathroom breaks during long meetings. Just make sure you know where the nearest restroom is at all times. Now let's talk about something that can make anyone cringe. Genital yeast infection. Yes, you heard that right. It seems that SGLT2 inhibitors can create a lovely environment down there for those pesky yeasts to thrive. So if you notice any unusual itching, burning, or discharge, don't hesitate to have a candid conversation with your healthcare provider. They'll help you kick those unwanted party crashers out. Next up, we have urinary tract infections or UTI. It's like a 2-for-1 special. Increased urination and the potential for UTIs. As GLT2 inhibitors can sometimes create the perfect breeding ground for bacteria to throw a party in your urinary tract. But fear not. By staying hydrated, practicing good hygiene, and seeking prompt medical attention if you suspect a UTI is a big help. Last but not least, we have low blood sugar levels. Now, this might not sound like a bad thing for someone with diabetes, right? Well, it's a delicate balance. As GLT2 inhibitors, along with other diabetes medications, can sometimes team up and bring your blood sugar levels down a bit too much. It's like they're overachievers in blood sugar control. So while it's fantastic that they're doing their job, it's essential to be mindful of the signs of low blood sugar and have some glucose-rich snacks on hand to give yourself a little boost if needed. When considering diabetes medications, it is crucial to have open and informed discussions with your healthcare provider. They can guide you in selecting the most suitable medication based on your medical history, lifestyle, and treatment goals. Additionally, monitoring your blood sugar levels regularly, following a healthy diet, engaging in regular physical activity, and maintaining a holistic approach to diabetes management are all important aspects of achieving optimal health outcomes. Now, a quick question to you, our dear viewers. What do you think about these new medications we've tackled? Let us know down below in the comments. For a more comprehensive understanding of this topic, please see the description box. We provide a list of the top 10 questions to ask your pharmacist when picking up your medication. This is not an all-inclusive list, and if you need more information, check out the link below. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is dedicated to providing valuable information on health and wellness that's made by a licensed professional. Times are crazy, and it's extremely important to be well-informed and taking care of yourself. If you enjoyed watching, please help us out by liking this video. In this way, we will know how well we're doing. And if you like more of these, consider subscribing and hit the bell notification to stay on top for more upcoming videos. Thanks for watching.